Oh,
What's up?
Part two. To in attack the English world. Okay, third podcast for Institut Neuro Performance at the moment. I'm here with Mike Arcuri, Nicolas Lapointe.
Arcuri.
I got two names. Yeah, I get.
Yep.
Okay, talk about yourself a bit before we enter the big subject. The big subject first of the day is the
For our course.
Sensorimotor Rehabilitation. So that.
There you go. Okay. So hi everyone. Very glad to be with you guys. For those who don't know me yet, I'm Mike. I'm a manual therapist, posturologist, athletic therapist, and I'm working with Nick since 2 years now. I can say that my main goal is to look at the human body the way nobody's looked at it when I was dealing with chronic pain in my early age. Look at all the systems because they are all well connected with each other's. One system can affect actually other systems. So I think that the biggest problem with the rehab today is that we are all look at the human body like it's a muscle, like it's a ligament, like it's a tendon. So we all need to load everything, all need to stretch and everything, and that's the main problem. So that being said, I was a young man, and still am, but dealing with a lot of chronic issues, a lot of chronic back pain, gut issues, memory dysfunctions, that nobody was even close to making any connection between those problems. So I was diagnosed with a couple hernia in my low back, L5, L6 instead of L5, S1.
One more lumbar.
What? Yes, one more lumbar. So I don't have my first vertebra of the sacrum. So that's not a big problem, but that can cause SI joints issues. Mm-hmm. So due to human disease too, and they say that there was nothing ever connected between those two problems. So I got a couple hernia, like I said, without any specific injury, without any specific trauma coming with it. So they are all treating the back. See a lot of therapists, like they was treating the SI joints, everything that was coming with the L5, L6, without any specific long-term results, until I see a chiropractor that was actually a posturologist, and he was working with functional medicine, and he said that the main issues was with my gallbladder and my small intestines. And I used to skip a lot of primitive reflex, and when I mean a lot, I mean like 8 or 9 or so. A lot of motor pattern. I used to crawl with only one arms, and so we treat the small intestines, we treat the gallbladder, we reintegrate all the primitive reflex that was still active in the body. Give us 3 weeks, then the pain was completely gone. So that's opened my mind a little bit on the subject, and that's why I started studying and teaching since then.
Nice story. Yeah. So I know a bit about the subject of pain myself too. Was living with a partial handicap myself, so still got issues with the gut and stuff. So I got the ulcerative colitis ulcerative. I forgot the name.
No matter. Gut issues.
Something about the rectum is coming down. Blood everywhere. Okay. So, yeah. So we're half dead people talking and teaching now. Okay. I feel better. Except your hair. There's something about your hair today.
Yeah, that's fake hair actually. That's not my real hair.
You eat some pineapple yesterday?
Look at the shirt.
Sorry for the podcast. You don't see Mike. So go on our YouTube and register. Yeah, Institut Neuro Performance. Gonna see Mike hair and do a comment about it. Hawaiian shirt. That's good. Okay. Fun.
There you go.
Okay, so you were like a zombie crawler with one arm. I got the picture. It was really good.
Yeah, zombie crawler. And actually, I didn't walk until 2 years. So zombie crawler for a lot of time.
Yes.
They used to think that it was funny and nobody was talking about it, even the doctor.
Mm. So everything seems connect now when we see our brain develop at a young age, and even in the belly of the mom, the brain developed by sensory reaction, exact. So stimulus gonna create electric exchange that go to the brain, and the brain got to rewire itself, create new neurons, new connection that permit him to interact with the environment and with it, in fact. So what's going on? A baby having difficulty moving is going to have difficulty thinking and so on.
It's gonna get a lot of problem, like with emotional issues too, and everything that's come with the
Mr. Frontal.
all the the central nervous system. Yep.
Yeah, frontal lobe permit the rationalization of emotion by the precortex, permit the posture, permit the movement with the motor cortex in it, permit the capacity of learning and memorizing stuff. So it was you were talking about the memory issues, stuff like that. Lots of brain comes from the gut too.
Yeah, but like I said, if I skip a lot of primitive reflex and primitive reflex all start in the frontal lobe, you can create some connection between those. And like I said, like a lot of memory issues, a lot of dysfunction at this place, and it wasn't like only in my early age. It was until like I was 18 years old, and
last year,
even today. Last year, yeah. I just graduated from high school, guys.
Nice. How old are you?
I'm 24. Actually, I turned 25. So.
Not so bad. Not so bad. You're not a brat anymore. Or you're a young man.
Yeah.
Okay. I got a pretty good tincture here. Nobody see my white hair, but I'm getting old.
Hey, I get to the barber too earlier.
Yeah. So okay, so the presentation about yourself is done. Great,
yep.
Mike. So on my side, I met Mike in a seminar, I think, of therapy, bioelectrical therapy, and was amazed by he got good skills. Okay, muscle testing sometime, and we're not on the same opinion. Okay. But, it's a pretty good manual therapist. Got good evaluation about the gamuts and stuff that I haven't masterized in my life. So it was cool to see someone I can learn with it, because the better we got, the less people we meet that impress us. So Mike was one of the guys that I was, oh yeah, nice, that's a good guy to know. So finally I opened my institute, and I shake his hand and come with me, baby.
Yes.
Some stuff to teach. And finally, we got the same vision. We got some kind of same path. Issues with the gut, issues with the body. Something that's no fun for a kid, having difficulties moving without pain. So it's getting not it's getting an obsession, I can say. That quest of learning to get better and heal ourselves, and finally heal other people, because we don't want anyone to suffer like that. Huh? So we know that we find something that have worked for us, so we want to share it with people. So that's a massive difference, I think, with people that haven't been through those kind of stuff. Usually they got their diplomate and or certificate, and they're happy with it. They can work, and that's it. That's the part that I think we always go farther all the time.
The people that always go further is always people that was dealing with pain and nobody can even do something about it.
Yeah,
That's if you look at all the people that doing posturology, and all the people that going further with the passion of treating somebody, it's always something that was happening early in his career.
Yeah, it's not the money issue.
That's funny.
It's not the money issue. That's a empathy issues. Want to be empathic, want to help people, and if we meet somebody that got a traumatic brain injury, even if we don't have, we can empathize them and feel what kind of difficulty they have in the day, and for that same reason, we're gonna try to help them as much as we can. So that's good. So like you said,
Yep.
people look at muscle, tendon, ligament, bones. Some other will check about everything is in the breathing. Some other people will check everything is on the posture. Some will say everything is in the blood, organs. So everybody is trying to deal with the tool they got in their hands. But the biggest kit of tool you got, the more chance you have to help the people deeper. So let's go about
yeah. It's all it's all about understand the concept, and then you can masterize a lot of things.
And keep aware of the novelty all the time, because there's always novelty. Technology, neuroscience, quantum physics is a big player in the game now. Everything that was not connected directly to medicine now is, and that's amazing. That's what I'm doing in doctorate. I'm doing in functional in integrative medicine. Sorry, and that's totally changing my concept of human body. That's a bit the quest of Institute, is to teach people new concept, new stuff, and every year the way I'm talking to my students is gonna change. But that I don't do 180 degrees change, but
no.
It's getting more complicated, more interesting on my side. So I want you to talk about the
for sure.
neurologic subsystems. That's the thing that you bring a lot into my practice now. That's mostly one of the first thing I'm doing, except the bioelectrical test that I'm doing, like my old test for the brainstem issues. And after I'm doing a primitive reflex, in second, and we're going straight into the neurologic subsystem and the 7 structure that interact with the diaphragms. And I bring you some function thing, but you bring me some of the theory, the concept behind it, and that's pure magic. Can you talk a bit about what's those neurologic subsystem?
If you first of all, the subsystem, for those who don't know it yet, it's all muscle and fascia that's connected with each other, so they can create functional movements in every kind of plane. Like we got 3 plane of dimension: sagittal, frontal, and transverse plane. We are understand that the transverse plane is the most efficient and the most important plane, so we can control and manage gravity. And the subsystem, it's all systems that was not created but developed early in the young age. So when we were like crawling until we got up, it's all subsystem that's used to connect every and each other bone with together. So to create really the transverse plane and the frontal plane, so we can move better and control our own body mass in every kind of situation. So let's say, by example, I got my posterior oblique chains. So I got my latissimus dorsi connected with my glute max on the opposite side. That was developed when I was rolling on my back. So when I was creating the motor pattern of rolling, I was developed the subsystem, so I can roll and turn and control the transverse plane in a more efficient way. Okay, good. So if you...
Those subsystems are created by the motor patterns?
They are developed during the motor pattern. So yes, they are gonna be able to develop the subsystem even if like I'm not crawling the right way, I'm not rolling the right way, but it's not gonna be efficient when I'm standing upright on 2 feet. So maybe if I'm not if I got some issues with rolling to the left, maybe later on, maybe I'm gonna have trouble with my left rotation or my right rotation because I didn't control it the right way in my early age. But that's not the first step that we want to talk about. I think that there's a lot of things that coming up.
I think it might come in the 3rd step. In fact, if I
the subsystem is not the most important thing that we are talking about in the course, but it's important when we are talking about the force transmission and sports injury and controlling like really the all the plane of motion. But this is not everything. We got a lot of stuff that it's more important in the course that come before the subsystems. It's just the little thing that maybe nobody talk about, and it's more important in sports injury, sports wise.
That's a good starter for the podcast anyway. So I just want to close the door of that.
Yeah, but maybe we can talk a little bit more about give me 2 seconds.
Yeah. So I'm gonna talk to myself. So the neurological.
No, it's all right.
It's fascia and muscle working together in a specific matter. It's like a road that we want to create to be fastest and more accurate and less dangerous. Imagine you can go, I don't know where you are on the map. They said every road leads to Rome, but if you take a little boat and go through the desert with a boat, it won't be optimal. If you take the sea with it, it might be better. If you take the plane, that's good. You need a map. You need a specific road that is adapted for the body to be more efficient, with less danger, more power, a better transmission. So you can develop. You're gonna develop anyway your posterior chain in an example, but will the fire sequence will be optimal? Like does the hamstring contract before the glute and after the contralateral erector and the ipsilateral erector? We want a specific pattern of contraction and or transmission between the glute and the latimus. So that's it. So that's some good knowledge to know, even for people that are only trainer or therapist, because it makes sense with that don't activate properly. That's a kind of an error to try to correct a movement when the muscle don't fire up.
Exactly.
The muscle fires by neurology, so by the interpretation of the brain and how we prepare that movement from a stimulus thinking. Example, I want to throw something. I'm not throwing something. I want to throw it. So my brain's got to fire a first sequence to the how can I throw something before doing it. So that's how we prepare movement. So before
that's the cerebrum.
We need to feel something. We need to feel where we are in space and have proper reflex.
Yeah,
the same thing.
So
the first part will be archaic reflex, I think.
Just want to make sure that everyone understand in the first place what is sensorimotor training, because I think that's the main title of our course. Because we are talking about the subsystem and everything in the cerebrum, but we need to understand first off what's the sensory training, because that sensory motor training, that's the title of our subject. So let's start I think with this. Do you want to start, or you want me to start? Because I can go on forever.
No, go. It's okay.
Okay, all right. So when we are talking about the sensory motor, the sensory motor rehab, training, treatment, or whatever it might be, we need to ask ourselves always 3 questions and 3 main things that to understand better subject. So first off, always tell people and tell the students, how do we localize our body in space? That's the first thing. The second thing is always about how do we reflexively compensate and plane and unplane movement of the head and the position of the head, and how do we stay efficient, upright, to manage gravity. Okay, so that's the 3 questions I always need to be asking before I treat someone, before I look at the mobility, the stability, and all the motor control they have. So to influence the motor control, the motor systems, we need to provide the nervous systems with quality inputs, so the brain can accept those answers and control those answers in a more efficient way. So the faster our brain can create safety for movements, and no needs to like productive outputs like weakness, pain, base tone, and everything. So when everyone's talking about posture, I think the misunderstand about the subject is they all talking about position. So that's why everyone say posture don't matter, because they say like they're arguing about the wrong thing. Actually, they're really arguing about the wrong thing. They say like if I stand on a, like if I sit all day, if I look at my phone in a certain way, if I work all day upright all day on my chair, it's going to create some pain, or it's going to transfer some problems when I'm going to train, or I'm going to move, I'm going to walk. And a lot of people like physio and evidence-based people say that really two things different, and it's not gonna affect the pain. It's posture, it's not a problem. But that's arguing the wrong thing, because it's not about I sit or I move and or everything. It's all about if my body can control my own body mass in every kind of situation, can I create and can I control balance? Because your body always gonna look for balance no matter what you do in life. So that's the biggest stress, the bigger factor of our posture. And if you're not even looking at a balance when you're trading posture, you not understand the real subject that it is. So
well, at base they're not trained in the vestibular function, so all the
yes,
the vestibular spinal reflex, everything that
there you go. So when we are talking about, like Nick said, it's all about the vestibular system, all about the eyes, all about the feet, because it's 80% efferent to the brain, so it can know where my body is are in space. And if I don't know where my body are in space, that's where actually it's going to create asymmetry in the body. And asymmetry, it's not about I'm doing a lot of things with my right arms, that's why I got a shift shoulder. It's more about you don't have any historic issues, but you got a shift pelvis, lateral plane problem, you got the neck rotate to flex to the right, and actually they don't have any problems with it. So you can say that this person partially have a eye tracking problem, don't feel the big toe, turn on the right when they close their eyes and make some walk. It's all about balance, like I said. If so the key question, like I said, how do we localize in body and space? If my body is efficient when I'm stay upright, and can I balance gravity? And it's all about the motion, and can I stay upright and right to the position of my head.
The body is trying to adjust itself under the head all the time, but the brain is the brain is wired to protect itself all the time. Body.
Yep.
And the third point, really interesting, the feet are the only one that are connected to the concrete world. So they're the only one that can permit power by stabilization of the body and create propulsion of the
proprioception.
Not proprioception. How to propulse the body in space.
Okay, propulse. Okay. Yeah, I get it.
Okay, so that's pretty interesting. So the head control the body, but the feet stabilize the body and permit all that stabilization before we create other movements. We need to stabilize before we mobilize.
There you go.
That's it. We can't avoid in any performance practice or therapy practice to fix the height, the inner ear, and the feet. There's no way. There's there's no joints under the feet, and no joints that you can control over the eyes. So you need to fix those, because otherwise it's like taking a towel and
twisted and
exactly. Yes, the center is going to have problem, the pelvis is going to have problem, everything's going to have problem, but fix the two extremity. By magic, the rest is going to feel better.
So I think it's important to look at the evidence base and all the mobility and everything, but you all need to check the balance first, because I tell you something, you're gonna find a lot of problems with a lot of people and they don't even know it. And when I assess people, it's like they said, it's the first time that somebody look at my balance, like but when I close their eyes and stay on one feet, they freak out. So it's common, but it's not normal. So we need to guess what's the difference between those two, because what is optimal is not necessarily common. It's you need to have balance.
Yeah,
So
talking about balance, that's a concept that is badly used over time.
And misunderstood. Yes,
there's writing reflex and tilting reflex. Both are not the same. If you are unstable on a stable surface, there's something. If you are stable on an unstable surface, I mean yourself on boots on ice, it's not the same reaction that yourself I don't know, on, how can I say, a clown use it, like pole, walk on pole on a stable surface. You're still unstable, but that's not the same way you're going to train them. It was a bussy ball for everything, you're wrong. So
yeah, that's what
surf. You're not surf. Surf it's a good example.
It's a good example, yeah.
That's stable. Your feet are on it, but the water is unstable, unpredictable. So slide and fall. It's not the same balance. So super good to be unbalanced on both of my foot. I can run on rocks, different size, jump over them. It's going to be perfect. Put me into water. Put me in water or on snow. I look ridiculous.
Yeah, there you go. And if you even look at like sports injury and sports wise, if you look at mobility problems, a mobility problem is always a stability problem, and it's always a motor control problem. So I can say that it's a balance problem too at the end of the day, because if my body don't know where we are in space, if I struggle with just standing on one feet, then what's going to happen with all the distal part of the body? They're going to freak out. They want to create stability. So while they're creating stability, they reduce the mobility because they want to make us stable. So if my ankles are locked and I try to mobilize something on the ankle because I want to create space in there so it can move more efficient, but I'm not actually looking at the real problem that he can't stand on one feet. Probably, what's gonna do? It's gonna recreate like the same problem that it do it in the first place. It's gonna lock up the joint, lock out the talus, and then maybe it's gonna take 2 days, and the problem's gonna be back again.
So we saw it often in the 70 iframes. The talus can be fixed. So you said that the motor is gonna be an issue, but the motor always need the sensory feedback. So if there is a faulty motor pattern that we can see, can evaluate, we got to check the sensory behind it. Not much people evaluate the sensory problem. So if you evaluate this, if the motor is getting problematic, an example of Mike told, the ankle is going to be fixed. Why the ankle is going to be fixed? It's going to be fixed because the brain want to create some stability, and he feel an imbalance over the ankle, so he's going to fix it. Okay. So why he fix it? Because he's afraid. He's preventing. You want to prevent damage. That's damage control. And if you have, example, a motor pattern that is off. Okay, somebody's shaking, somebody whatever, lack of precision or anything, lack of mobility. What's going on is the brain receives the sensory input, and it's not perfectly clear. So it's going to have a non-clear motor reflex, motor pattern, because the motor pattern needs to have the sensory feedback coming from the receptors of the body. So when you create a beautiful movement, the sensory problem is there. So that's a bit the problem with the physiotherapy. We're talking people that don't look at posture as an evaluation system, because posture is a proper sensory input. It's not a motor input. Static posture, it's a sensory input. Yeah. We're not checking a movement. We're not checking a moving pattern. We need to check both of them. That's what we do in clinic now, and that we teach in the sensorimotor rehab, because we want to see people statically first, to evaluate the proprioception, and after we want to test how they react in front of a outside movement, outside stimulus, like we push the person in certain direction, and we look out what's the strategy of the body to adapt that
stimulus,
damage control reaction of the body. Can he contract? Can he stabilize itself, or he's just falling apart? And if he's falling apart, we know now, okay, the problem is not proprioceptive anymore. Most of the time when we fix the proprioception, those subsystems are better. As we tested, you remember in the first times, doing a feet and eye stimulation feet and eye stimulation, and the body was more stable. In fact, like 90% of the muscle reactivate, so that's helping. But after we still got some issues with the 7 structures that stabilize the diaphragm. So now we decide to do those, we call them interoceptors at first, because that's how the body learned to stabilize itself with himself, not with the outside world.
Yeah, because we breathe a lot in the minutes, and if your breathing is not as efficient as the way you move, it's going to be the same problem again. So early on in my career, I was only like reset the diaphragm, because I used to know that if you have a breathing problem, it's a diaphragm problem. But but everything was coming back again, so I was trying to look at the structure that was moving when we get into a breathing pattern and everything. So all the structure that move in the body, the way in the way we breathe, need to be stabilized, and need to be in the proper movement, so the body can then create movement by those movement in the body. So we need to test each and every one of them. Organs move too, so we can like say that you got 50 diaphragm, if you say so. We just look at the priority of the breathing pattern.
Yeah, 7-1. We get those structure in interaction with the diaphragms are the spheno-occipital joint, the palatate for the tongue. You got the
hyoid bone. You got the scapula. You got
scapula for vagus nerve.
Yep. And the vagus nerve, it's a pretty bad boy too. You know, the vagus nerve always gonna create a lot of security problem of the nervous system if it's track, or if it's if it freak out and if it's inflamed. So we need to check that boy too. And you said
we're said not done with those, the thoracolumbar fascia.
Yeah, thoracolumbar fascia,
pelvic bone, and the talus. All's gonna imagine the body when you're breathing. It's like compacting itself and unpacking itself all the time. So it's in position of stabilization and unstabilization. But in fact, we're supposed to be able to breathe and stay strong. Okay, imagine a fighter, if he hit and he can't control his abdominal wall, he won't be able to receive a punch while he hits. So that's the best example. We can't be sloppy and receive a hit. It's going to be our end. So we need to be able to receive an impact all the time. So that's the kind of interaction that we're looking for. So we need that synergies going through the system. If it's one's moving before the other, you're going to be as strong as or weaker the chain system. Yeah. So go for it. Sorry.
No, I was just making a little part of what you said about the sensory information, just to clarify everything for everyone, because we talk about sports wise and sports injury. If the way that it's working, like if I stimulate my right arms, by example, if I stretch the right quad, or creating some
the quad,
quadricep. Yes. I'm actually giving a message to my right cerebrum that's gonna create another message to the motor cortex on the opposite side. Then it's gonna create some message to the frontal lobe, and then it's gonna make me stable, or it's gonna make some movement about it. So we all know that by fact that the cerebrum is pretty well connected with all the movement that we do. So the better and the more efficient I can create a stimuli on the opposite way, the better I'm going to create stability and actually control movement. So if I'm jumping and somebody's going to create me some impact when I jump, how do my brain gonna transverse those messages so I can like stabilize on my 2 feet after this. So it's all about the message that the cerebrums give to the motor cortex, then to the frontal lobe, so I can now be in a better position to accept those stimuli. Like I said before, it's a productive output. If I'm not have the stimuli of the efficient way to the nervous system that can control input, then it's going to create a different output, and it can create damage in the long term.
It's interesting to think that the brain, the extrapyramidal pathways, is 90% of activation coming from the stabilization chain. Stimulate the brain. 90% is coming from the posterior chain, and the pyramidal pathways, 10% only of the brain is occupied with the perception of the efferent wave. How the brain is going to send information to the body to move, in fact. So 90% of our brain is wired to stabilize, 10% to move. When you think about it. So if you have a stabilization problem, be sure you got a motor problem.
So you got a sensory problem then.
It's sensory at base all the time. So you need to feel, to know where you are in space before you move. And while you move, the cerebellum is going to continue to receive inputs all the time that I'm moving. Yes, I'm moving. Now I'm there. Now I'm there. I'm coming. Yes, you're there. Yeah. Okay, it's time to complete the inhibition of the tricep, of the bicep, and activate the tricep. And when you do the invert motion, that's the same. Okay, let's inhibit the tricep, activate the bicep. Yes, I'm coming. Whoa, relax. You're going to hurt yourself.
Yeah. That's why if we only what we do is massage or stretch or load the joints, it's going to create some results. I mean, but if the problem is an issue, it's a sensory problem, then it's not going to be a long-term fix.
We're doing castle in the sand when we're doing just manual therapy like that, without really rewiring the brain, just moving sands, and every time a wave's coming, everything fall apart. The person to leave your table, to have a walk and come back in 1 week, and everything's going to be back in place, because the brain haven't changed its perception of the body that much.
The way you walk, yeah. Because
pattern, you can't cheat the gait.
80% of the time we are walking, we are standing on 1 foot. So if I'm not stable on 1 foot, then you manipulate or you massage the cuff and everything you might find on the treatment. Then the person is gonna walk off your door, and the brain's gonna freak out. Like a second ago, they created the stimuli. So that's why if you don't fix the problem on 2 feet, then you can just layer the client on the back and then treat them. And the problem is not going to be solved at the end of the day.
Excellent. I want to open the subject of archaic reflex, primitive reflex. Think about them. Talk a bit about it.
About it.
I was using them. In fact, myself, I was using them. Finally, I stopped using them because when I started doing functional neurology, basically every time I was fixing something in the brain, helping the brain to rewire itself with the body, I can say, optimizing the brain and the body function. Some of those reflexes were getting reintegrated by themselves. So I was working with the feet, the inner ear, and the eyes. So most of the reflex come there, except some spinal reflex. So I was lacking of interest in those. I was keeping the fear paralysis reflex and the motor reflex because a lot of emotional problem and a lot of sensory input problem come from them. The thalamus is going to be overcharged by some stimulus. But
there you go.
Anyway, just by fixing some of the environment of the person, by fixing skin polarity problem, muscle problem, posture problem, eyes emotion, meridian chakra, anything, biochemistry problem, this nervous system was getting better, and those problems were less and less coming. So finally, I just moved them away from my practice. And now, guess what? It's the first time, the first thing I'm checking again after a biological trouble.
Yep.
I want to make sure that if those are in the line, I mean, mostly fear paralysis and motor reflex, is going to shut down the sensory integration, because the brain is going to be always in the reptilian brain, activating the brain's crazy, like everything. The brain perceives a possible danger. I hear a sound, maybe it can be dangerous for me. I taste something, can be a problem. Somebody touch me, can be harmful. So most people live an adaptive life.
There you go. You got it.
Just to prevent them from danger all the time, and that's really bad. So I was treating them, but now I'm doing all my list again. Since we teach that course, that course even for me, and I guess for you too. We exchange some really cool stuff together. It changed our practice, because when we go back to the office, we say, "Hey, man, you teach me some nice stuff there," and I think it's the same for you. And now we have to practice, and finally, it's getting more similar all the time, because makes sense. It just makes sense.
But I'm with you. I think that it's important to test them in the first place, just to see if they still.
Yep, you're frozen.
Active, and then create
okay.
with
say that again, please.
You lost me, huh? You lost.
Yeah, exactly.
Like I said it's important to test them in the first place to see if it's still active in the body and the nervous system. But then it's more on the end that we're going to correct them, because like you said, when we correcting the emotional stuff in your first courses of ENP, when we are like creating proprioception of the feet, stimulating the eye, the vestibular system, good for the TRL, so the lymphatic stimuli, it's all gonna maybe like help for the primitive reflex, but it's important to retest them again to see if they are still active or not. So that's the reason why we want to test them in the first place. And just to make everyone clear it out, primitive reflex are like a reflex action organized in the nervous system that was were all created in the frontal lobe early in your age. So like you put a finger on the ends of the baby and they're gonna grab the finger. So that's a reflex. Just to it's all reflex that are normal to protect the baby and to develop their brain, so they can stand on 2 feet and create their motor pattern and everything. So one reflex have to be managed and inhibit in the first place to let the action of the others and vice versa. So if one reflex is still active in the body because the baby was the parent was always screaming at them and it was always not in the security place and everything, maybe the paralysis reflex gonna still be there, the motor is gonna get track and everything list goes on. So we need to check everything in the first place. We need to check every reflex, they are still active or not, because it's not going to affect only the posture and the way we move. It's going to affect, like Nick said, all the emotional stuff, all the way you talk to people, the way you socialize with other person, and it's going to create maybe some trauma issues with early on in your age. So yep.
Yes, I can show a bit of a palmar reflex. I got to finish to correct my motor reflex. It's almost done. But look, my palmar reflex is good here. If I go here, look, my finger open themselves. My finger move by themselves. So that's a bad palmar reflex. But I got to fix my motor first, because every reflex stack themselves over one another. So it's not, I can't fix that one if the other one under is not good. So that's it's like to build a stage over a house, but the foundation is off. See? everything's gonna fall apart eventually. So
yeah,
yes.
and every reflex work with a motor pattern too. So if I'm talking about eye-hand coordination, well, while you look at somebody that's benching or squatting and they are shifting to one side, maybe they got like a palmar reflex that's still active, a poor high-hand coordination. For my part, I didn't crawl. I didn't even like create those cross line in my cortex. So if I didn't crawl, then I have a lot of issues when, like I said, the transverse plane, the eye-hand coordination. I got a lot of issues with that. So if a palmar reflex is still active, an example that is great is you look at somebody posture and they're gonna have like a closed hand a little bit more. If you look at them do a chin up, they're gonna lose their grip on the end that the palmar reflex is still active because they can't control the grab, all the grab leading stuff. So it's gonna create then a problem on the proximal way.
Yeah, the hands want to open with the stimulus. Yesterday, I started back the gym and I was doing some weightlifting after what I'm able to lift easily, and my hand couldn't sustain the training. My God, what's going on here? My forearms are screwed. Doing climbing for me was something pretty insane too for the hand. So I developed super massive hands here. Those muscles doesn't need to exist, but exactly everything was coming by the thumb because those weren't working properly. But in the bench, this one was a bit more like this. So that end. So it's going to be transposed and create problem for all your life. That shoulder is going to be forward too because the chain is messed up.
Yeah, because if you have like a distal problems on the end, like I said, it's going to create problem then on the proximal way on the shoulders. So it's all going to affect
shoulder, neck,
all the structure.
The writing with that end is
you got neck pain, VOR problem.
Exactly. Yep. So those motor patterns are developed aside with the reflex. So as we move and use our hands, we create like an inhibition. What's going on when the reflex is going to be properly integrated? My body is going to create my brain motor neuron inhibition. So that inhibitor is going to be in place and it won't react anymore. They will have a sensory stimulus, that's it, but no motor reaction, reflex coming with it. So it's not done on that side. It can be on one side or two side or no side, but we get to check those because even if I want to train like crazy, I got the trouble with my proprioception on that side. That's coming from here. It's not coming from something else.
Yep.
So motor pattern, I'm going to create a movement in function of what I feel. If what I feel is not completely okay, if I got some motor reflex that's coming through my movement is going to be messed up all the time. So otherwise, I'm going to have a bad sensory motor response. That's going out to my brain, and my brain is going to compensate all the time. So it's going to be there's going to have a lack of efficiency, and too much energy is going to be expense for nothing. That's it. So do you have any motor pattern that you can talk about it just to make a link with those primitive reflex?
Yep, you can talk about in English. I think I lost the reflex in English, but I think in French. Ouais, le réflexe asymétrique du cou. So I think it's a asymmetrical reflex of the
neck reflex.
Asymmetric reflex. Yes. So if you don't control this one is the yep. If you can test it, it's when like a baby is looking, it's flexing all the arms and the hips, and they're looking at the other way or the same way. This is gonna create some eye-hand coordination, and then it's exactly at this time that you create some connection between the right hemisphere and the left hemisphere. So when you're creating some connection between those two hemispheres, then you're gonna create some good motor pattern of example crawling, because crawling is a cross pattern, and cross pattern is really important when we talk about the frontal lobe and execution of movement in an efficient way. So it's all start in this reflex. So you need to test the reflex first in the first place, so to see if they control it, if it's still active or not. Then you can look at what they're crawling, if they're crawling at the same side as the ends and the hips, and if there's no connection between and no cross pattern between those two. So if you say like to child, touch your left hands to the right hips, and they touching the left hands to the left hips. So they want to do it, but they can't do it because they don't have this cross pattern in their left and in the right hemisphere. So it's all started in this primitive reflex. That's why I said primitive reflex are pretty much important if you want to work with someone that have memory issues, or maybe like more of a difficulty to stay focused, difficulty to learning, emotional stuff, and problem with sports injury, and difficulty with durability, force, power, everything that come with it. So they hit a plateau, and that's why you need to look at these primitive reflex in the first place.
What's going on is the brain, the two hemisphere of the brain is going to be are going to be connecting by the corpus callosum. So if there's a lack of movement on the left side of the body, the right brain is supposed to fire up. But we need a communication between those two brains. And where there's a lack of efficiency of the stimulation of the corpus callosum, the hemispheric part of the brain is going to have a bad coordination between them. And for memory formation, everything is going to be sensory integration. We need our two brains to interact properly. So example, if we need to write down a story on a sheet of paper, we need to use a specific technique using an example of cerebellum, ice tracking, and stuff. We think about the rules of our language, example, French, English, whatever. There's rules with things, with some word, and we got to over the lines in a proper way. So that's pretty left hemispheric, while the right brain is trying to create the story, something good, using good words, and need those two. And those two are trained by sports, by movement when we are young. A baby that's not moving is going to be a baby with difficulties, with issues later on. So that's those reflexes are not only good for a kid. Later on, when we find an adult with those problems.
Oh yeah, pretty much. I got 45 years old clients in my office last week, and they got like 6 or 7 primitive reflex. So they're gonna do this live. They're gonna study. They're gonna do their stuff, but their brain gonna compensate all those years for the lack of focus and lack of efficiency of their brain, so they can have a frontal lobe problem, temporal lobe problem, and everything. So that's the reason why we need to check those reflex first, because they started on the 0 to 1 year. So if you're not looking at those, what causes do you looking at? Because we cannot getting early in this stage.
The brain eat up. What's going on? See, we're not all a ADHD problem, huh? Easy to diagnose people with those, but in fact, it's not the lack of medication that we have in the blood. We got a brain communication problem. And our brain parts communicate through learning, through stimulus, and if the stimulus are badly perceived by the brain, sorry, dude, the brain's gonna do the best he can, but he can't. Okay.
Yeah, so if you're gonna stop the medication, it's all gonna come back until you stimulate the right reversive reflex.
So to make it short, we learn in that course to evaluate the body, how you interact with the environment, with itself.
So
with those structure, we evaluate for the rest the lymphatic system too. Because the lymphatic system, that's a huge player. That's a player that it's not well addressed in the therapeutic plan. except the aesthetic girl that's are using
the massage therapist that's looking at it a little bit. Yeah,
$1,000 machine to do drainage, but it's not specific. It's not exactly there's no palpation of where the lymph is blocked. Is that painful? Is that a desactivation of the muscles around, or does the joint are doing their job in place? That's a lot of stuff. That's a lot of stuff to check. It's good to see those kind of therapists, but the best, if you go see our guys that we train with those techniques, that's massive. Okay, that's life changing. With exercise to do home, if you just do you just go to a lymphatic drainage and you don't have any recommendation about how much water you got to drink, what to do to prepare your body. With example, with the bath, sodium bicarbonate, some salt. We got all those dosage to give to you to help the toxin stored in fat to get released. How many? Just for the water, 50 pounds or 23 kilos of body pounds, you need 1 liter per measure. So if you're 200, you need 4 liters of water per day. So that's it. So you need proper balance of sodium, potassium, in fact, too. But that's already a good numbers to.
Yeah, and the body needs to reintegrate the water in the body 3 liters a day. So if you're not drinking the way you're supposed to drink, then it's all gonna be messed up in your lymphatic system too. So that's the reason why if you look at the lymph first, you need to check if the person is drinking water in the first place, because that's so basic, that's so first thing first being, but that's that's the origin of the problem. So yes, definitely I want to say 2 names.
That's our flush system. We need to flush the water in the toilet. We need to do the same in our body, and with it, we need water.
You need water. You need there you go.
If you extract toxin out of the body, but you don't have water to put it away from the body, it doesn't matter how many lymphatic drainage you do.
So in this course, like I said, it's my favorite system because if you don't look at the system, you're gonna be inflamed a lot. And if you're inflamed, no matter what you do with your nervous system, the way we create like a sensory input and everything, if the body is always inflamed, then it's always gonna be in a security paradox that don't want to heal in the first place. So if you want to look at the lymphatic system, you want to look at the liver and the spleen a lot, because c'est quoi rein in English?
Kidneys.
The kidneys, then, my bad. So in the kidneys, because it's all about detox, and if those are inflamed too, the lymphatic system, it's all like gonna be messed up too. So in this course, you want to look at the lymph first. You want to look at the liver, all the organs that detox the body, recreate like a reset of those ones. Then we're gonna create some stimuli on the brain to really create a more balance on the left side of the brain and the right side of the brain, so we can be more efficient in the way we move, the way we stay upright, the way we perform, the way we listen at somebody, the way we concentrate for a course or whatever it might be. So I think we didn't pass a lot of things. It's not about just a neurology course. It's about functional medicine mixed with neurology application. So I think it's pretty obvious that this course is have a lot of things to teach to
Got some pretty awesome critics about it too. So that's it. Hey, seriously, you open the door. If the body keep being into the security mode, the brain doesn't want to integrate new values because he still perceives them as nociceptive. But at the same for the client, the patient, if you give him exercise and you still got inflammation every day, you won't believe in your practice.
There you go.
Do his job, and his job is to shut down the inflammation by drinking water and doing the lymphatic movement, the things that's going to stimulate the lymph. If you don't do it, the brain won't integrate it. Neither he is, because he will say the stuff haven't worked because he's still in pain. So
There you go.
That's an important point to talk about. For the rest, well, the point I think we didn't inform. If you have a better stability, you got to check the foot sensitivity. Okay, we got a technique. We're stimulating 5 different kind of receptors, sensory receptors, in the foot. It's doing tons of good into the fascia line and into the proprioception and the skin of the foot. Just by using that, eyes and inner ear stimulation, 90% of the muscle we test are reactivating. So that course is really good magic. Level 1, we teach inner ear and eyes re-education. Not in that course, but we give some stuff for the inner ear to help.
In the level 2, we're gonna talk a lot about it too. But
oh yeah, so I know you're going into some travel today. Going to do some surf or whatever.
Yup. That's where I got the shirt.
Okay. And the Hawaiian look and the ananas, the pineapple over your head.
It's flowers, but
yeah,
okay.
Funky colors behind. Excellent. I got a water here, just waiting for you. Watch out. There are 4 weird people right here.
It's me and you.
Yeah, holding his hand. Right, thanks a lot, Mike. You have Instagram, I think. If people want to register, follow you a bit.
Yeah, I got an Instagram. I post a lot of chess photos. So if you want to look at it, no, I'm kidding. But yes, I got a website coming on pretty soon. We're gonna talk a lot about autoimmune disease with a lot of great people, and you can find me and reach me with Neuro Performance too. Because you got a lot of big stuff in there. So there we go, man.
Institut Neuro Performance.com. I'm gonna send the links over the bio of that video. Share, please. First of it. Go on the site, register. We're building a mail list. Register to our podcast. We got some great stuff is coming here with tons of people around the world. Because we're doing good. And Instagram, Institut Neuro Performance, same thing. Facebook, Institut Neuro Performance, mostly French for now, but Instagram, mostly English. So come talk to us. It's going to be a pleasure. We're there for you. Gonna translate the site real soon. But for the rest, just keep following. The more English people there is, the more English content is going to have. So thanks a lot, guys. It was fun. Leave your comments. Ask your questions. It's going to be fun to answer you, okay? Bye, guys.
Bye, guys.
I have great fun. Thank you.
Thank you, man.